How to reduce medical bills that were run up in a personal injury case. Well, unfortunately, personal injury cases, by their very nature, involve injuries, and injuries need to be treated by doctors. And medical professionals these days are very expensive. So, what do you do? Well, in one scenario, you have no insurance, you have no lawyer, and you're just getting bills that you have to pay out of pocket. So, if your insurance carrier for the other side calls you up and says, hey, let's settle this case right now, and the settlement is this number and your bills are almost the same number, you can get a hold of your medical provider and say, hey, look, I've got an opportunity to settle this case. I can't settle it based on what your bills are, but if you're willing to reduce your bills, then I can get this settled and get you paid now. And you would be surprised how many medical providers would actually agree to lower their number so they can get paid now instead of some unknown time in the future. In a second kind of scenario, you've got insurance, you're fortunate, you're paying your deductible, you're paying your copay, and your insurance company is probably going to tell you, hey, we've got a lien on the case, meaning that when it resolves, they're going to try to get reimbursed. Well, this scenario works almost the same way. If you're trying to work out a settlement directly with the person that injured you or their insurance company, you would say to your providers, hey, look, I've got a settlement number that's, a certain amount, and your medical bills make it impossible for me to settle the case. But if you're willing to reduce your medical bills, then I can settle the case and get you paid now. So that is certainly worth pursuing. In a third type scenario, you've got a lawyer. Your lawyers helped you set up a lien situation where you're working with medical providers to get your treatment now, and the medical providers are willing to get paid later. So in this scenario, your lawyer does the legwork for you. It's your lawyer's job to negotiate the settlement with your approval, of course, and it's your lawyer's job to reduce the medical bills. So your lawyer will get on the phone with your medical providers and say, hey, look, we've got the situation. We can settle it for this dollars. Your bills are too high where we can't settle the case. But if you're willing to reduce your bills, we're going to get you paid now because we're going to settle the case now. And oftentimes the medical providers will do that. And so then the case can be resolved. So the moral of this story is, are medical providers going to provide reductions 100% of the time in every single situation? Well, probably not. But it's worth asking, because if you don't ask, the answer is always going to be no.